If you're going to have a cash practice, you have to have your value right, and you have to be able to communicate that value effectively to your patients.
Welcome to AMC. I'm Dr. Greg Miller. Do you have a cash or private pay practice? Today, Dr. Tara Horrall is going to go over what it takes to make this important business shift. You won't want to miss her advice on the true value of the visit. If this video is valuable for you, please click the like and subscribe buttons. Let's get started.
Thanks for joining us. Do you want less stress, better commitment, and improved patient compliance and patient results in your practice? Do you want better control of your income? And do you want more referrals in your practice? If so, then really, why not consider a cash or a private pay office? I talk to doctors all the time, and students as well, who really think that cash practicing is the easy way to do things. And I'm not going to tell you, because I had a cash practice for 15 or more years, and I started that way from scratch. I'm not going to tell you there weren't easier things about having a cash practice. But to be honest with you, if you're going to have a cash practice, you have to understand that you have to actually be tighter in your patient communications, your procedures and protocols. You have to be tighter, or at least very strong, in your patient education, in your patient communication, really strong in your conviction and your chiropractic philosophy. You've got to have a very well laid out and innately designed and decorated office. You can't be throwing up red flags to these patients with your decor and with a poorly planned layout, and still have patients consistently follow through with care in a private pay office. Again, it is a simpler way to practice, but it definitely is not always easier. Because again, you have to set up many of these things very tightly on the front side. You have to have a very well-trained staff, both in their protocol, in their patient education, in their chiropractic education, the staff's chiropractic education, in their ability to communicate with the patient as well, and in their conviction for why patients really need care, why your care is important, why your care is valuable. Look, if you have a cash practice, I know a lot of docs have a cash practice, and they think because they have a cash practice, they need to be the cheapest guy in town, and that's what makes a cash practice a cash practice. Look, that's not what we're talking about at all whenever I talk about a cash or a private pay office. Many of the doctors that I work with in private pay offices have somewhere between a $65 to $210 collections per patient visit average with their patients. And the reason is obviously they're not the cheapest in town, but they have the greatest perceived value from their patients. That's because they've educated their patients well, they have strong conviction, and they've induce that conviction to the patient as to why they truly need care, why the care is important for their health and for their life. And again, they're giving that patient more value in their office. Their office speaks value from the moment that the patient drives into the parking lot, when that CA call on the phone, when they're booking their new patient appointment. It's all speaking value to the patient, to the point where when they get to the point where they're ready to sign that check, they understand that they're trading dollars paid for results received, and it feels like a fair trade for them. So again, you don't need to be the cheapest in town in order to get patients to commit to a cash plan. And if that's what's happening for you, you definitely need some help in one of those other areas. Again, increase your perceived value for the patient. You need to know your worth. You need to really stand on what you're doing for that patient and what you're saving that patient from. I've had patients who've been to, and you've had them too, they've been to, let's take, for example, a patient that I had that had neuropathy in both feet, down the legs, had numbness and tingling in the hands, was having debilitating migraines, brain fog, had gone to Mayo Clinic, and they told this patient after 4 to 5 MRIs, several CT scans, and many, many other tests and procedures that there was nothing that they could do for the patient, and gave him some big long word about neuritis. Well, again, you start seeing the patient, you see this laundry list of all of the things that they've done. Well, there's dollars and signs and life value behind every single one of those the procedures that were done, the tests that they've done, and really behind the frustration and the hopelessness that that patient feels. So again, do not underestimate the value of what it is that you're giving that patient. The patient I'm talking about couldn't exercise, couldn't focus. This patient is a musician, could not play the instrument that they play without pain and debilitation afterwards. And because of the care that we've given him, was able to restore the ability to do his job, to think more clearly, to have more patience with his family, to be able to exercise for the first time in years and have energy. I mean, that's just health and vitality flowing through this patient now because of the care that we were able to give him. Again, there's value to that care because, again, the patient had already spent $20,000 to $30,000 on testing that had gotten them nowhere before they got to my office. And then again, with the course of care, they didn't have to do that anymore, and they finally got their life back. What is a patient's life and future life worth? What is it worth to you? What is it worth to the patient? What is it worth? You can't put a value on a patient's life, on their quality of life, on their hobbies, on their family and being able to spend their time with their family, on their independence. Gosh, independence alone is huge, especially with your Medicare age patients, because the fact of the matter is, even if they're going to have a housekeeper, that has a value to it. That's expensive, right? It's expensive for someone to go into an assisted living area. It's very expensive for that patient to go into a nursing home. Not only is it expensive in dollars and cents, but it's expensive in life value. It's expensive in their emotional and mental well-being. It's expensive to the family. So again, consider this whenever you're writing a care plan for your patients. You really need to be writing that care plan honestly, based on what it is that their problem, the severity of the problem that they have, and where they're headed. Understand and communicate that the value of the patient's care is always seen in the future. It's always what you're saving them from. So again, if you're going to have a cash practice, you have to have your value right. And you have to be able to communicate that value effectively to your patients. And again, a cash practice may not be the easy road, but at the end of the day, it's a lot less stress. Your patients refer more because they value and they respect what you do for them. They're more committed to their care, so it's a less stressful practice. They're more compliant. You don't have to call them so often. They love coming into your office. Again, they love what you're doing for them. And you're more in control, not only of your practice, but of your income, because you're not waiting on a third-party payment consistently. So again, if you want a less stressful, better committed patient, and again, if you want to improve compliance and results in your office, as well as more control of your income and better referrals, consider a cash or private pay practice. And again, if you want to know how to do that easily and effectively, especially from the beginning, but even if you want to transition, call us here at AMC. We've helped lots of people through that process. And again, we can help you through that as well.
Join us at our next training weekend, May 12th through the 14th. If you're new to AMC and would like a free guest pass to 3 days of material just like this, text us at 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice.